The programme itself is a professional development programme. It's not an academic taught programme with academic credits. It's a blended set of learning resources that help people to develop professionally and help people to think about their own professional development, which is really important. So we have a number of workshops where leadership issues and leadership theories, and especially systems leadership thinking, are explored. Alongside that, everybody's part of an action learning set, and we do real learning in those action learning sets based on the reality of everybody's working lives and working situations. Alongside that, everybody does a leadership impact project. So actually this is very much about how do I apply my leadership learning and thinking in practice on an everyday basis, and how can I then demonstrate and share that learning with other people.
To see nurse leaders from a variety of settings in social care at management level and above participating in this programme, coming in at the beginning with a need to develop confidence, to understand what their contribution could be, to how they could contribute not just to their local setting but to the wider social care environment, and to see where we are today, which is the culmination of the course, to see the projects that they've delivered upon and to hear their stories. It's amazing, because the programme has not only given them confidence, but it's given them the language to help them articulate what their distinct contribution is as nurse leaders in the social care setting. And these nurse leaders have been able to reflect on their own practice, but also the practice of their teams.
Oh, I just thought it was incredibly so good, so powerful, so empowering. It just made me a totally sort of different type of person, you know, come a long way from the last 6 months. It helped me build my confidence.
The feedback sessions that we've had, the learning tools that we've had, not only have they been good for me personally, but I will use all the stuff that I've learnt on the course and implement it with my carers, with my support workers.
My project was to try and empower the coaching and mentoring skills of existing staff to support new starters. We deliver a really good corporate induction, but when they were going onto the households, the existing staff, some of them didn't have the time to put into coaching and supporting the new starters to a high standard, and we had that feedback. So we went back to basics and we delivered a mentoring session to identify the existing staff where they had any not so confident in coaching and mentoring the new starters. And we also took the people that did have the confidence in coaching and mentoring to buddy up with them. So it was a bit of a helping hand for everybody.
For my project, I developed peer reviewing of care plans and risk assessments. It's kind of universally used across the care sector, but within our organisation we haven't actually utilised it yet, and it's given me the confidence then to take that forward to the team and to develop it within the team.
My project is compassion in end of life. So every time we have a resident in end of life, I'm doing 10 minutes meeting with the staff. So we spoke about that resident, about the symptoms, about any change. They can ask any questions if there are concerns, and I found it very helpful, and I felt that we add more value in the care of the resident. So we really had very good feedback from the staff and families.
Nurse midwifery and care staff can identify and address emergent variation, and by doing so ensure that their practice is equitable for those that they care for, and can demonstrate improved outcomes, experience and resources. Really pleased that the work that's been happening within this course will be demonstrated and published on our web pages to help disseminate this work and share this great practice with others.